My name is Devlin Hanson, and I'm an economist with the Urban Institute. Together with my co-author, Sarah Gillespie, we wrote the article, Housing First Increased Psychiatric Care Office Visits and Prescriptions While Reducing Emergency Visits. Our work builds on evidence from prior studies that have demonstrated Housing First increases housing stability for people who have experienced chronic homelessness. We implemented a randomized control trial to test the effects of supportive housing with a Housing First approach on healthcare use, Medicaid enrollment, and mortality. Our study included 724 people experiencing chronic homelessness who had frequent arrests in Denver, Colorado. 2 years after assignment to the Housing First intervention, participants in the treatment group had more office-based visits for psychiatric diagnoses, more prescription medications, and fewer emergency department visits than the control group.
I'm Sarah Gillespie, a researcher at Urban Institute, where my work is focused on the impact of interventions to end homelessness on other systems, including the healthcare system. In this study, we evaluated the healthcare effects of a Housing First program. In contrast to approaches that require people to receive treatment for mental health or substance use disorders before securing housing, Housing First is built on the idea that people must have safe, affordable, and permanent housing to consistently engage with other services, such as needed healthcare. Recent federal data show the number of people experiencing chronic homelessness is the highest ever since data collection began. As policymakers seek increased funding to scale up effective ways to meet the needs of people experiencing chronic homelessness, our results offer evidence that a Housing First approach not only can provide a housing solution, but also can facilitate engagement in healthcare services and decrease emergency healthcare visits for a population with many healthcare needs. To learn more about what our study found, you can read our study in the Health Affairs February 2024 issue on housing and health.